show starts in 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Go. Bass in your face. Bass in your face.
Everybody, welcome to another episode of Uncommon Sense with Jose Negro. Now, for the benefit of those of you who are not the channel or watching this channel for the first time, the reason why it is called Uncommon Sense because here we discuss everyday issues. We try to find logical solutions, but not everything. So for that reason, it is called Uncommon Sense. I have a called Latina Diaspora where I discuss Latinos in the United States. The link to the channel is in the description. But you know that I'm currently live on Facebook and Instagram. And also, the subscriber mode has been enabled in the first 5 minutes. Meaning, if you are not a subscriber and if you wish to enter a comment in the chat, you have to be a subscriber and for at least 5 minutes. And as always, I want to shout out to all those who already subscribed to the channel. Whether you've been a supporter from the beginning or does me fine, I really appreciate and love and continue to support. Also, I want to shout out to all those who follow me on social media. Also, shout out to all those who allow me to enter into your devices and those who watch from the clouds. So, what I'm going to ask you to do if you have not done so already, I'm going to ask you to please subscribe, like, and set the bell notifications on. So therefore, whenever I do produce content, we'll have the opportunity to catch it live or catch it on the playback. So tonight's topic is depression. So what I'm going to do is I'm going to describe what it is. I'm going to describe some of the symptoms and how it could be. You know, I discussed this topic, but it's very important that we continue to be aware of this issue because unfortunately there is some sort of social stigma attached to mental health issues, particularly if you are a male. Now, before we get to the main topic, we're going to do another episode of My Words. Now, on a story about a black woman who got through the divorce, which she slept with 4 men in a week. The reality is that I by women. Now, some of them they are legit domestic violence, abandonment, and then there are other reasons that the board has made this up, so to speak, to basically try to find my own version. But unfortunately, this woman decide how to deal with the divorce by becoming, which I would like to refer to as recreation center, and engage intercourse with women. More than whenever engage in intercourse. What happened is, con, but you also get united with all the, and we also conclude the internet. Of course, the best thing to the confines of marriage, but we realize that not many people follow that role. It is what it is. But it seems like there's some women that have competition to see how they can say them both. And the state of so-called empowerment. Um, First of all, empowerment does not mean that you have to sleep with every pookie and ray and pretty and no. True empowerment means that you're empowered with the ability and the tolerance to become successful in life. Empowerment does not equal being promiscuous. Now I know that some will not, but what can I say? It's true. Okay. Now, the next thing, the next thing I want to talk about is, of course, next week we'll approach the anniversary of September 11th, which remember the tragic um, when almost 1,000 souls were lost due to terrorist attacks. Okay, and of course, the time of grief, the loved ones of those perished. What we can do is hold these people in our thoughts or prayers and believe in God for us. One thing we have to bear in mind is that grief has no expiration date. People can still be grieving about a loss of a loved one 30, 40, or 50 years after the fact. And when it comes to shedding of innocent, blood of innocent people, it unfortunately reinforces the fact that tomorrow is not promised to anyone. That we should value our time, value our loved ones. And we also need to self-reflect how we are and answer the question. Um, if you die today, where you spend eternity. Now I know people who like to think about death, and let's keep it real. It's not an easy topic. However, um, we all live life and we all have to be mindful of our choices. So, with that being said, we're going to get into the main topic. Now, before I continue, let me just state for the record that the link to the channel has been pinned. Should anyone wishes to hit that link to the panel and to opine regarding the topic ahead, they can do so. Of course, let me make this also perfectly clear that if I never seen you before, if I never heard from you before, I will insist that you come up in the backstage and land on the panel. And the why is obvious. The last thing I want to do is let some person, a control, come on the panel and then either flash anything inappropriate or try to upload porn, which will cause the people up here to take down. Now, once I determine that you're not going to show that you want to respect the guidelines of this platform, you will be allowed onto the panel. Whether you decide to come up or not, that's something I'll leave up to you. I'll probably be on this line for perhaps an hour. It all depends how things go. Okay, so what I'm just checking. I'm sorry, I just have to. So let me give you the definition. What is depression? Because here on this channel, we don't just talk about something, we actually give the definition of what is the term. Depression is a common mental health condition characterized by persistent feelings of sadness, loss of interest, and other symptoms that may interfere with daily life. Now, there are some causes which we think about depression. The exact causes of depression are complex and not fully understood, but factors that may contribute include biological factors, genetics, brain chemistry, imbalances, and medical conditions. Psychological factors, negative thoughts and coping mechanisms, stressful life events, and trauma. Social factors, social isolation, lack of support, and cultural expectations. So let's deal with the symptoms. And then there may be others, but they basically include persistent sadness or low mood, loss of interest or pleasure in activities previously enjoyed, changes in appetite or weight, sleep disturbances, uh, either insomnia or excessive sleep, fatigue or loss of energy, difficulty concentrating or making decisions, feeling of worthlessness or guilt, thoughts of self-deletion or betrayal. Okay. To diagnose depression, healthcare professional will typically conduct a physical exam, review medical history, and ask about the symptoms. They may also use standardized questionnaire to assess the severity of symptoms. Now, there are several ways to the treatment of depression. One way is through medication. Antidepressant medication can help regulate brain chemistry and improve mood. Therapy, cognitive behavioral therapy, or CBT, and other forms of psychotherapy can help individuals identify and change negative thoughts or patterns and coping mechanisms. Lifestyle changes, exercise, good nutrition, and getting enough sleep can improve overall well-being and reduce symptoms. Support groups, connecting with others who have experienced depression can provide support and understanding. Now, here's something to consider. Depression is one of the most common mental health disorders affecting an estimated 264 million people worldwide. It is more prevalent in women and men, and the incidence increases with age. Now, depression is a serious condition that significantly impacts daily life. It is important to seek professional help if you also know to experience symptoms of depression. With appropriate treatment, individuals can recover and improve their overall well-being. Okay. So, what this tells me is, first of all, um, it is a serious issue. Okay. Okay. Maybe 1946, 64. Okay. Or you belong to certain part of you're taught to be we're told to be tough. We are told to just, you know, just suck it up and keep on going. Now let's deal with. So what we're gonna do is there are five main symptoms causing depression, and let me state what it is. The definition: the persistent overwhelmed sadness or emptiness, a noticeable loss of interest in pleasure and activity, significant change in appetite or weight, persistent lack of energy and difficulty sleeping, whether it be insomnia or oversleep. Now, there are common symptoms of depression. They are number one, persistent sadness, emptiness, or hopelessness. The negative feeling of feeling down, sad, like there is a constant emphasis that doesn't go away. Loss of interest or pleasure. A significant decrease in interest or pleasure in activities that were once enjoyable, such as hobbies, social activities, or even sex. Changes in appetite and weight. Experiencing a significant unintentional weight loss or gain, or an also decrease or increase in fatigue and lack of energy, feeling consistently tired, sluggish, and lacking energy to perform in small daily tasks. Sleep disturbances. A noticeable disturbance in sleep pattern which can manifest in insomnia, difficult sleep, or hypersomnia, sleep too much. Now there are also other potential um, symptoms to be aware of. Feeling of worthlessness or excessive guilt, difficulty with concentration and decision, irritability, restlessness, or changes in behavior, physical ailment without a clear cause such as headaches or stomach problems, and of course, the most serious one, thoughts of death or self-defeat. I have shared on numerous occasions that I have had bouts of depression and actually had thoughts of myself. Fortunately, I'm still here because of help and plus prayer. Of course, we have certain questions. Can depression go away? And the answer is yes, but it often requires professional treatment, such as medication and therapy. Well, it's not something you can just snap out with, with willpower. With the right support and treatment, most people experience full recovery. However, some individuals experience recurrent episodes of depression. It makes it crucial to continue working on a healthcare provider to find effective strategies. Now, this is something that it's very important. Seek therapists. Okay. And again, many people because don't seek out but saying, um, I look at science to rational. Okay. And this is not something that you can snap out there by yourself. Okay. Now, of course, the question is how could you check and see depression? Good question. To check if you have depression, monitor your mood and behavior for persistent sadness, loss of interest, changes in or appetite, and fatigue that interferes with daily life lasting more than 2 weeks, at least 2 weeks. Self-screening tools and questionnaires can provide insight, but professional diagnosis is made by a healthcare provider who will assess your symptoms, medical history, and or the blood test throughout other conditions. Now, we already addressed the symptoms you want to look out for. Now, if you want to go get a professional diagnosis. Number one, consult a healthcare provider. Your doctor or mental health professional is the best person to accurately diagnose depression. Number two, complete questionnaire. Maybe complete a self-reporting questionnaire such as a bed depression inventory to help you assess. Number three, a medical exam. A healthcare provider may perform a physical exam and other blood tests to rule out other health problems cause similar symptoms. Number four, undergo psychiatric evaluation. Mental health professionals ask detailed questions about your thoughts, feelings, and behaviors to understand your personal and family history of mental health conditions. Now, this is something that artists explain indicate how once the doctor has this information, then prescribe with a therapist, right? Uh, and help you to assess um, what are what are the issues, how to deal with it. Okay. Now, one thing to bear in mind that never let the person go unchecked. Okay, 'cause it is a serious condition. Now, what I'm gonna do is I'm gonna share with you the consequences of what happens should the person is left unchecked. Now, untreated depression can have severe and far-reaching consequences affecting both mental and physical health. So so first I'm going to discuss with the mental health consequences. Persistent and worsening depression. Depression can become more severe and chronic over time. If left untreated. Increased risk of self-deletion. Untreated depression is a significant risk factor to self-deletion. Now, the reason why I term self-deletion is because there are certain words and certain terminology which makes the people of very nervous. And next thing you know, if they get too nervous, they may shut down the stream. So I'm trying to prevent that from happening. Another consequences of depression left untreated is Difficulty with daily functioning. Depression can interfere with work, relationships, and social activity. Increased risk of other mental health disorders. Untreated depression can increase the likelihood of developing other mental health conditions such as anxiety, substance abuse, and eating disorders. Now, there are also physical health consequences to allowing depression to go unchecked. And just to let everyone know, those who are coming in now, the topic for tonight is depression. So, dealing with the effects, with how to treat it, and we also now dealing with what are the consequences allowing it to go unchecked. Now I'm talking about the physical health consequences. Increased risk of chronic disease. Depression is associated with an increased risk of chronic disease such as heart disease, stroke, diabetes, and cancer. Sleep disturbances. Depression can lead to insomnia, excessive sleep, or nightmares. Changes in appetite. Depression can cause either loss of appetite or overeating. Physical pain. Depression can cause chronic pain, even in absence of clear physical cause. Weakened immune system. Untreated depression can make an individual susceptible to infections. Now, there are also other consequences dealing with depression left unchecked. Social isolation. Depression can lead to social withdrawal and isolation. Financial problems. Depression can interfere with work and lead to financial difficulties. Relationship difficulties. Depression can strain relationships with family, friends, and of course, if you or someone you know is experiencing depression, it is crucial to seek professional help. Treatment options such as therapy, medication, or combination of both can effectively manage depression and improve quality of life. Now, there are some particularly if it gets to the point when you are thinking about self-deletion. The first source is the National Suicide Prevention Lifeline, and the number is 988. When you can dial or text or go online and you can speak with a professional, not judgmental, and will help you deal with it. And particularly if you're having so of course, text line, literally you can speak with someone in text, but type in your text the word HOM to 741 741. So, and of course, in New York, we have an NYC Wells where you can speak, obtain therapy. Now, as I stated, um, I had bouts of depression. Um, experiencing financial difficulties, mainly employment, have a broken heart, betrayed by. Okay, but anything can contribute to the person, whether it be loss of employment, whether it be the ending of a marriage, whether it be the loss of a loved one. Um, Speaking as you get older into the golden age, enter your 60s, 70s, person because of loneliness. Okay, and how happens is older, more and more people pass away, or they, okay, and fail to come. Sometimes it could be because of estrangement. Okay, which is why every now and then I continue to state and emphasize that if you have unresolved with loved ones, if you can try to get those issues resolved, because the worst thing that should happen is you are estranged with people, loved ones, for whatever reason, and that person passes away without the opportunity of trying to make your peace. And it is one of the worst things that can happen. It's one of the worst experiences because then about the guilt of the time. Um, Sometimes now you should have said apologize and a whole list of right, right. If you are experiencing estrangement, I do love one or a close friend. If you can, try to make the effort to reconcile. Okay. Other person does not wish to reconcile with you. At least, okay. And if that person does pass away, you can say to yourself that you tried to reconcile. Now, one thing you have to bear in mind, reconciliation requires two people. It needs one person reconciliation, and it also needs the other person to accept reconciliation. Some people are not at that stage that they can be reconciled, and who knows why. What we know is that, as I stated before, that depression is a serious condition. Okay, there it says. I was trying to look up something bear with me. Okay, here's a mental health resource, which is known as NYC 998. No, 988. So let me just share with you what is um, Access New York. NYC 988 is your connection to free private mental health support. Speak to a counselor via phone, text, or chat to get access to mental health and substance. Now, you can call or you can text. And of course, the number down is 988. Now, when you use the number, you have to listen very carefully uh, for the prompts. Press 1, support. Press 2, Spanish. Press plus support by digit 25 code. Now, I'm going to say something in Spanish and then I'm going to give you translation. Sí, persona que necesita de salud mental te puede mandar un texto al poner en texto la palabra ayuda, que es A-I-A por español. So what I did was, if you are someone that can Spanish, send a text to not text word Spanish line, in Spanish. Or if you happen to be a member of the L and below 25, text the word to speak with a company. Now, if you can send text and clarify if you are a veteran or because when you think about veterans, I mean, you don't know there's something that to do, particularly if they fall in war. But prepared, you call 711, then 986 for death or heart attack. And of course, if you are dangerous mental or attention, call 911. Now, the phone services help is everywhere. any time of the day stress, depression, anxiety, finding long-term counseling, alcohol, or other drug use, acting with peer support spectrum have similar experiences, self-prevention and crisis counseling, and also now there are counselors that speak Spanish, Chinese. Education services are also available in over 200 languages. Now, the good thing is all New Yorkers can speak with a counselor and NYC9AA services, regardless of your citizenship or immigrant status. Also access service right away at any time. Now, if you want to chat, go to the NYC9AA website and ask, or you can call 311 and ask for NYC9AA. So, now, the reason why I share this information is here we believe in sharing information. We're not going to just discuss the issue, we're also going to resources. Okay. So I'm going to give some more. Of course, you have 9 8 for crisis support and NYC. Well, now as far as general mental health services, uh, good evening, much for stopping by. So, topic of depression is described the cause as also how to treat. So, department of mental health, mental health, provides of mental health, mental health Omega, NYC, and referrals for mental health. Now, if you're going to contact Help Connect, text support, self-prevention hotline specifically for our an older classic mental health is also the second line with 24 hotline for health, mental support, and NYC Elder Resource Center provides information for elder care including mental health. Basically, the whole point first of all is experience mental health. So I have uh, talked to hit the link and the line to go where I actually have money how to deal with discuss and so does not exist. The problem is health village check it body. Okay, there's no one watching like that. I might have to consider um moving like that. There is no good help. Okay, okay. It's something that many people go through according to statistics. Not 264 million. bouts of depression. So that's something. I get okay. Um, I, I discuss. Okay. And up something. Habits, sleep habits. Okay. Okay. So, okay, just I will continue. Now, comes back to talk about sense